8 body odors that could signal cancer. Could your body odor be trying to tell you something life-threatening? The smell you've been noticing might not just be embarrassing, it could be deadly. We all worry about smelling bad in social situations, but what if I told you certain unusual body odors aren't just awkward, they're actual warning signs your body is sending you about cancer? Today I'm breaking down 8 specific odors that medical research has linked to various types of cancer, what causes them, and exactly when you should be concerned enough to see a doctor. This information could literally save your life or the life of someone you love. Cancer changes your body's chemistry in ways you can often smell before you can see any other symptoms. Think about it, dogs can be trained to detect cancer through scent alone with up to 97% accuracy. That's because cancer creates specific volatile organic compounds that produce distinctive odors as tumors develop and spread. Let's start with one of the most concerning odors: a sweet, fruity smell on your breath. This isn't just morning breath or something you ate. When your body can't properly process glucose, it creates ketones that have a distinctly sweet, almost fermented fruit smell. While this is commonly associated with diabetes, it can also signal pancreatic cancer, which disrupts insulin production and glucose metabolism. About 80% of pancreatic cancer patients develop diabetes before their cancer diagnosis, often noticing this peculiar breath odor months before other symptoms appear. What makes this particularly important is that pancreatic cancer is often called a silent killer because it typically doesn't cause noticeable symptoms until it's advanced. By the time most people are diagnosed, the cancer has already spread. The 5-year survival rate for pancreatic cancer is only about 10%, but catching it early can dramatically improve those odds. Maria, a 52-year-old teacher I interviewed for this video, told me her husband noticed her breath had a strange, sweet smell for months before her diagnosis. He kept telling me it wasn't bad breath, just different, she explained. I brushed it off as nothing until I started losing weight without trying. When she finally saw her doctor, tests revealed pancreatic cancer. Because of that early detection triggered by the odor change, she's now cancer-free 5 years later. The second odor to watch for is a persistent, unpleasant smell coming from your urine, specifically a strong, fishy odor that doesn't go away even after increasing your water intake. This could signal bladder or prostate cancer. These cancers can cause changes in urine composition, leading to distinctive smells long before other symptoms like blood in the urine appear. Dr. Sarah Chen, a urologic oncologist I consulted for this video, explained, cancer cells metabolize nutrients differently than normal cells, creating waste products that can alter urine odor. Nearly 40% of my early-stage bladder cancer patients report noticing unusual urine odor before any other symptoms. What's particularly concerning is that bladder cancer has a high recurrence rate. About 70% of cases come back after initial treatment. The third cancer-related odor presents as an unusual sour smell from your skin, particularly around your armpits or groin. That persists despite good hygiene. This isn't your typical body odor from sweating. It's distinctly different and doesn't respond to normal deodorants or frequent washing. This particular odor has been linked to liver cancer and certain types of leukemia. These cancers change your body's metabolic processes and can release specific compounds that are excreted through your skin. Research published in the Journal of Cancer Research and Clinical found that melanoma, lung, and breast cancers also produce specific volatile organic compounds that create distinctive odors. James, a 47-year-old marathon runner, shared his experience with me. I was in the best shape of my life, but suddenly developed this weird, sour smell that wouldn't go away no matter how much I showered. His doctor initially dismissed it, but James insisted on further testing. A blood panel revealed early-stage leukemia. My doctor later told me that if we'd waited for traditional symptoms to appear, my prognosis would have been much worse. The fourth odor to be aware of is rotting smell from your mouth that's unrelated to food. This specific odor has been strongly associated with oral cancers and cancers of the esophagus. These cancers can create open sores or lesions that become infected, producing a distinctive, decaying smell. What's troubling is that oral cancer cases are rising dramatically, especially among young people who don't have traditional risk factors like smoking or heavy alcohol use. HPV-related oral cancers have increased by over 225% in the past 3 decades. If you notice this smell persisting for more than 2 weeks, especially if accompanied by mouth sores that don't heal, white or red patches in your mouth, or difficulty swallowing, see your doctor immediately. The 5th concerning odor is a fecal smell coming from vaginal discharge. While vaginal odors can change for many benign reasons, a persistent, foul, distinctly fecal odor can be a warning sign of cervical or endometrial cancer. This happens because these cancers can create abnormal connections called fistulas between the reproductive tract and the colon. Dr. Lisa Montgomery, a gynecologic oncologist, explained to me that this symptom often gets misdiagnosed as bacterial vaginosis multiple times before the underlying cancer is discovered. By the time patients come to me with this symptom, they've often been treated for infections repeatedly without resolution, she said. That delay can mean the difference between a treatable early-stage cancer and a much more serious late-stage diagnosis. Cervical cancer screening rates have dropped in recent years, making awareness of early warning signs like unusual odors even more critical. When caught early, cervical cancer has a 5-year survival rate over 90%. That drops dramatically to under 20% in advanced cases. The 6th odor signal is a persistent ammonia or bleach-like smell that seems to emanate from your sweat or skin. This distinctive chemical odor has been associated with certain types of kidney cancers and some blood cancers. When cancer affects kidney function or blood cell production, it can lead to metabolic changes that alter the chemical composition of your sweat. Kidney cancer is particularly concerning because it often doesn't cause symptoms until it's quite advanced. By the time traditional symptoms like blood and urine or flank pain appear, the cancer has often grown quite large or spread. However, these metabolic changes that create the ammonia-like odor can occur much earlier in the disease process. Robert, a 63-year-old retired electrician, told me his wife noticed a distinct chemical smell on his skin for months before his diagnosis. She kept telling me I smelled like the bleach she used for cleaning, even right after showering. He said when he finally mentioned it during a routine physical, his doctor ordered comprehensive testing that revealed a small kidney tumor. Because it was caught relatively early, it was successfully treated with minimally invasive surgery. The 7th cancer-related odor is a distinctly metallic smell on your breath or from nasal discharge. This unusual odor has been associated with lung cancer and certain types of brain tumors. The metallic smell occurs because these cancers can cause microscopic bleeding that releases iron compounds that produce a metallic odor. Lung cancer remains the leading cause of cancer death, largely because most cases are discovered at advanced stages. Traditional symptoms like persistent cough or shortness of breath often don't appear until the disease is well established. However, this metallic odor can sometimes be detected much earlier. In a groundbreaking study published in the Journal of Thoracic Oncology, researchers found that nearly 30% of early-stage lung cancer patients reported unusual breath odors months before diagnosis. Special breath analysis devices are now being developed that can detect these compounds, but in the meantime, being aware of this potential warning sign could save your life. The 8th and final odor to be vigilant about is perhaps the most specific, a distinctive musty, earthy smell similar to wet cardboard coming from your skin or breath. This unusual odor has been linked to certain types of liver cancer and advanced colorectal cancers. These cancers can cause changes in liver function that alter how your body processes and eliminates certain compounds. When these compounds accumulate, they can create this specific musty odor that patients and family members often describe as similar to damp cardboard or old books. What's particularly important about this signal is that liver cancer diagnoses have tripled since 1980, and outcomes remain poor with a 5-year survival rate of just 20%. However, when caught early, survival rates increase to over 70%. Remember that unusual, persistent body odors are just one potential warning sign among many, and they don't definitively mean you have cancer. However, being attuned to your body's signals, including how you smell, can help you detect potential health problems earlier. If you found this information valuable, hit that subscribe button right now for more potentially life-saving health insights